Hi there, I'm Hisham Shalaby. I'm an orthopedic foot and ankle consultant in Edinburgh. I will speak in this video about the surgical management of cartilage lesions within the ankle joint. I will focus in this video on large lesions and their management with a technique called Autologous Matrix Induced Chondrogenesis, or AMIC for short. The ankle joint is a very common site for injury during sports and many of our daily activities. Most twisting and inversion injuries of the ankle joint result in ligament damage. This presents with a combination of pain and instability that usually requires short periods of immobilization followed by physiotherapy. The management of ankle joint ligament injuries will be covered in a different video. In spite of proper conservative treatment and physiotherapy input, some patients continue to experience ankle pain following an injury. The pain here is slightly different from that caused by ligament damage. The pain is usually in the form of a deep, dull ache with very little, if any, sense of giving way and instability. This could be a sign of a cartilage lesion within the ankle joint. Like all our joints, the ankle is covered by nice glistening cartilage. This cartilage allows the movement to happen in a seamless way. This cartilage is supported by strong subchondral bone that helps the joint to withstand the weight and the stresses applied on it. The injury usually causes a crack in the cartilage. This allows the fluid from within the joint to escape to the subchondral bone. This causes an area of increased pressure within the bone, which in turn affects the circulation of this segment, causing it to die. This creates a weak spot within the joint and causes this deep, dull ache that the patient experiences on any physical activity. The treatment of these cartilage lesions depends on thorough examination and investigation with X-rays and other modalities like an MRI or a CT scan. The management depends on the symptoms the patient is experiencing, as well as the size and the location of these lesions. Other factors that affect the decision-making include the age of the patient and his general health, including smoking, as well as the condition of his ankle joint and whether the remaining part of the joint is still healthy or has started a process of arthritis. The management of smaller lesions can be done with a technique called microfracture and will be discussed in a different video. In this video, I will explain the surgical management of the large lesions. This is done using a technique called Autologous Matrix Induced Chondrogenesis, or AMIC. This used to be a large open technique. It was initially necessary to break one part of the joint to gain access to the lesion. This is called a malleolar osteotomy. In my practice, the joint is now exposed through a mini open technique with no need for a medial malleolar osteotomy. The overlying unsupported cartilage is removed and the lesion is debrided, clearing the non-viable bone down to healthy bone. The bed of the lesion is then drilled with multiple drill holes. The defect is then filled with bone graft, usually obtained from the heel. The lesion is then covered by a collagen membrane. Blood travels from the healthier bone towards the lesion, and the bone graft starts to integrate with the surrounding bone. Cells from the bone graft gradually forms a cartilage-like layer from the collagen membrane. If you sustained an ankle injury more than 6 months ago and you are still experiencing a deep, dull pain in the joint when you walk for longer distances or when you exercise, you could have sustained a cartilage lesion. You need to be examined and investigated by a specialist. Thank you for watching.